Effective methods of contraception. Birth control pills, also known as oral contraceptives, are a type of hormone-based contraception that prevent pregnancy by stopping ovulation and thickening cervical mucus. They are over 91% effective when used correctly. Intrauterine devices, IUDs, are small, T-shaped devices that are inserted into the uterus by a healthcare provider. There are two types of IUDs, hormonal and copper. Hormonal IUDs release a small amount of progestin to prevent pregnancy, while copper IUDs work as a spermicide. Both types have a failure rate of less than 1%. The contraceptive injection is a type of long-acting reversible contraception, LARC, that uses the hormone progestin to prevent pregnancy. It is injected into the muscle by a healthcare provider and is effective for up to 13 weeks. The failure rate is less than 1%. The contraceptive patch is a type of hormone-based contraception that releases estrogen and progestin through the skin to prevent pregnancy. It is worn on the skin and changed once a week for 3 weeks, followed by a week without a patch. The failure rate is less than 1% when used correctly. The contraceptive ring, also known as the NuvaRing, is a small, flexible ring that is inserted into the vagina by the user. It releases estrogen and progestin to prevent pregnancy and is effective for up to 3 weeks. The failure rate is less than 1% when used correctly. Barrier methods of contraception, such as condoms and diaphragms, work by physically blocking the sperm from reaching the egg. They are typically 85 to 98% effective when used correctly. The contraceptive implant is a small rod that is inserted under the skin of the upper arm by a healthcare provider. It releases the hormone progestin to prevent pregnancy and is effective for up to 3 years. The failure rate is less than 1%. Sterilization, such as a tubal ligation for women or a vasectomy for men, is a permanent method of contraception that prevents pregnancy by surgically blocking the fallopian tubes or vas deferens. The failure rate is less than 1%. The contraceptive sponge is a small, round sponge that contains the spermicide naloxone 9. It is inserted into the vagina before intercourse and blocks the sperm from reaching the egg. It is about 91% effective when used correctly. The contraceptive pill, also known as the morning after pill, can prevent pregnancy if taken within 72 hours of intercourse. It contains a high dose of the hormone progestin and works by preventing ovulation or fertilization. It is about 75 to 89% effective. The contraceptive shot, also known as Depo-Provera, is a type of progestin-only injection that is given every 12 weeks to prevent pregnancy. It is about 94% effective. Natural family planning methods are a set of methods that help to identify the fertile and infertile days of a woman's menstrual cycle. The women can use this information to either conceive or avoid pregnancy. These methods are based on observations of cervical mucus and basal body temperature. They have a failure rate around 25% to 30%. Effective methods of contraception. Birth control pills,